Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your own microphone.
Good afternoon. It looks like you're wearing green, you're wearing green, you're wearing green. I can't tell. I'll go with the socks. Thank you for joining us. We've got a lot of information, a lot of territory to cover in today's availability. But first, I just wanted to, we're going to get to Dr. Box and we're going to get to Dr. Weaver. We've also got Patrick Tam, who is in Terre Haute, remote at a restaurant in Terre Haute, Indiana. Patrick is the president and CEO of the Indiana Restaurant and Lodging Association, and so he's going to give us a kind of an assessment of where we are and kind of as we look out how much progress we've made and where we're going. So very important. Obviously, we've been rolling out our vaccination protocol, and it's pleased to see numbers continuing to tick up and up and up. Obviously, this is one way that we slow the spread, so the more people that take the shot to get the shot, it's just getting us to that other side even that much quicker. We had some large-scale or mass vax sites, and maybe you all could touch on that. This weekend we have a mass site in Gary.
Lake County.
In Lake County. And then we'll also have one at Notre Dame. Go Irish as well, later in the month. So as the supply gets to us, we get it in arms, and we all get through this even faster. I did want to say I just had a stat come across my desk that a little bit of NDOT trivia. Which is a little bit off topic, but it's pretty impressive. It reminds me of our vaccination methodical approach, but you can recall going back, a couple years ago, we decided to invest more in making sure we weren't just building and maintaining our interstates and our highways around the state of Indiana, but we were going to do a better job of keeping them clean, and we had rightly been cited for some debris and litter on the sides of the roadway, and it's really been paying off. And I hope Hoosiers and our visitors, as they work their way across America and drive right through and hopefully spend some bucks here in the state of Indiana, they're noticing that as well. We had a concerted effort here in central Indiana, just to use one example, on the 465 corridor this month, and just yesterday, according to the report that I just referenced, crews picked up 3,000 pounds of litter, filling 200 large-scale industrial trash bags along 74 miles of that interstate. So kudos to NDOT, and I just bring that out because more and more people are going back to work. We saw our unemployment rate drop again to 4.2%. More and more people are getting out and about on the roads across America, but certainly here at the crossroads of America. And I just ask you to pay extra attention, keep your eyes on the road, because people are out there working. And with construction season coming, we want to make sure that we're all being safe, and that everyone that's working on those roads or cleaning those roads, because you're going to see a lot more of that, get to go home as well. And with that, I will turn it over to you, Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. In just 3 months' time, nearly 2.2 million doses of vaccine have been administered in the state of Indiana. That total represents more than 1.3 million unique individuals, which is an increase of nearly 147,000 from last week and represents nearly 20% of our state's population. Of those individuals, more than 870,000 are fully vaccinated, up from nearly 745,000 last week. This means that 12.7% of our population has received either 2 doses of Pfizer or Moderna or a single dose of the Johnson & Johnson vaccine. Indiana has administered more than 85% of those doses we have received, which is above the national average of 80%. This demonstrates how quickly we are working to get vaccines, once received, into the arms of Hoosiers. We are working to meet the federal directive to make all adults eligible to receive vaccine by May 1st. Whether we have vaccine available to everyone who is eligible, though, depends on our supply of vaccine. We have said all along that the one thing that limits our ability to open vaccine eligibility more broadly is the amount of vaccine Indiana is receiving each week. The federal government determines our allocation. We always seek as many doses as possible. In at least one report, Indiana was 5th from the bottom in doses delivered per 100,000 residents last week. Yesterday, Indiana was 35th in doses delivered per 100,000 residents. Our state is 17th in population. Indiana appears to be receiving thousands of doses per 100,000 residents less than some other states, according to information that we monitor on the CDC website. Our goal is to get more shots in arms in Indiana, so we're eager for the vaccine supply to increase substantially. According to our reports from the federal government, we will begin to see a greater supply of the 3 vaccines the last week of March. The push to get more vaccine becomes more urgent each day as variants continue to emerge and take hold. As of yesterday, Indiana has had 57 cases of the UK variant reported on the CDC's map, and new cases continue to come in. This variant is much more transmissible, and we need more people vaccinated so that we can win this race between the vaccine and the variants. We have demonstrated repeatedly that we have the ability to get shots in arms quickly, equitably, and safely, and we will continue to advocate for more doses for Hoosiers. If you're eligible to be vaccinated, I urge you to make an appointment or talk to a trusted healthcare provider if you have questions and want more information. We continue to see Hoosiers who are eager to get the vaccine. 72% of Hoosiers age 80 plus have scheduled or received a vaccine. 75% of those age 70 to 79 have done so. 63% of those 60 to 69 are getting vaccinated, and 43% of those ages 50 to 59 are in line or have gotten their first dose. While those in their 50s continue to lag behind other age groups in vaccine sign-up, we have seen an increase of about 12% since last Wednesday. And 23% of those ages 45 to 49 have signed up in the first 2 days of eligibility. These numbers include nearly 145,000 first and second doses administered to residents and staff in long-term care. This week, we also made educators and support staff eligible to receive the vaccine at sites statewide. We know that at least 20,000 have made appointments through our state system since Monday, but we don't have a complete picture because some from this group may have already been vaccinated through the federal pharmacy program or made appointments because they were eligible due to their age. We also continue to be encouraged by our positivity rate, which remains at 3.1% today for the second week. We have seen another decline in the number of Hoosiers hospitalized with COVID symptoms. The number of Hoosiers hospitalized with symptoms of COVID was just over 600 yesterday. This is a significant drop from the nearly 3,500 who were hospitalized back in December. and hospital admissions for COVID have fallen below 70 a day, which is the best number we have seen since last fall. Our color-coded county maps also continue to look good. The number of counties in blue on our 2-metric map has risen from 61 last week to 65 this week. All other counties are in yellow. Our advisory map, which indicates the level of restrictions that counties must follow, shows just 1 county in orange for the 2nd straight week and no counties in red. 55 counties are now at the blue advisory level, up from 42 last week. This means that more than half of the state is currently in the least restrictive advisory level, and that is certainly good news for all Hoosiers. Today, we reported 16 new deaths, which brings our total lives lost to 12,893 when you include both confirmed and clinically diagnosed deaths. While the number of deaths has risen dramatically, we know that every death dramatically. We know that every death represents a loss for an Indiana family and community. As I've mentioned previously, residents of long-term care facilities have been significantly impacted by this pandemic. I want to share some recent guidance that the CMS has issued regarding visitation. According to the guidance, indoor visitation shall be allowed at all times with only a few exceptions. These visits can occur in single occupancy resident rooms, but are still discouraged for residents in double occupancy rooms. Physical touch, such as hugging, is permitted for residents who are fully vaccinated, provided that the residents wear a well-fitting mask and perform hand hygiene before and after physical contact. Facilities must allow up to 2 hours per visit unless unique circumstances make that impossible. Those circumstances would need to be discussed with our regulatory division in advance. In addition, outdoor visitation will no longer be automatically suspended in the event of a facility outbreak. Each facility must continue to implement core infection control practices, such as visitor screening, social distancing, and wearing masks. But these changes represent a vast improvement to the quality of life for our most vulnerable Hoosiers. And we know that many families will be extremely happy to reconnect with their loved ones. And now Dr. Weaver will provide updates with our vaccine rollout.
Thank you, Dr. Box. This week, we expanded eligibility to educators and school support staff in K-12 settings and to Hoosiers age 45 and older. We are also highlighting on our high-risk portal that data supports that pregnant women are at higher risk for complications from COVID-19 infection. More than 100,000 Hoosiers with conditions that put them at higher risk for severe illness or death from COVID have now had their information entered into our secure portal, and those individuals will be receiving unique links to sign up for the vaccine. In total, these additions represent more than 500,000 additional Hoosiers who can receive a COVID-19 vaccine. It is exciting to see the joy from Hoosiers who are able to receive their vaccine. During our mass vaccination clinic at Ivy Tech Community College in Sellersburg last weekend, nearly 5,400 people made their trip to get their Johnson & Johnson vaccine. Some of them came from as far away as Lake County. Nearly 22,000 Hoosiers were vaccinated at our first 2 mass vaccination clinics this month at the Ivy Tech and Indianapolis Motor Speedway, and are now protected against COVID-19. We will add to those numbers over the next 2 weekends through our vaccination clinics that are planned in Gary this weekend and at the University of Notre Dame on March 26th and 27th. As a reminder, these clinics will offer only the Johnson & Johnson vaccine, which requires a single dose. No second doses of Pfizer or Moderna vaccines will be available at these locations. So if you scheduled an appointment to receive your second dose at either of these clinics, please cancel so that someone else can take the slot. And if you are coming to these clinics, please ensure that you can show proof that you live in Indiana and meet the current eligibility requirements upon arrival. We will not be able to vaccinate residents from other states. We are doing everything we can to expand access to vaccine as quickly as possible and to ensure that it is available equitably across the state. We will offer more mass vaccination clinics when our federal allocations increase. Our mobile units will deploy to areas with limited access to vaccine and high percentages of minority or vulnerable populations. This will begin next week. We will start in Elkhart, Tippecanoe, and Floyd, and expand over the next 4 weeks. The initial appointment should open late tonight or tomorrow morning. The state's Homebound Hoosiers program also has nearly 2,500 people entered into the portal. Our EMS partners have completed nearly 300 vaccinations so far and show another 145 in progress. We have added a new feature to our vaccine location map. We have several high-volume sites across the state that do not fill appointments as quickly as the smaller sites. If you're interested in going to one of those sites, look under the High Volume tab and search for the zip code of one of those clinics. These clinics are located around the state, including Clark, Floyd, Grant, Hendricks, Knox, Marion, Orange, Ripley, Rush, Shelby, St. Joseph, Vanderburgh, Vigo, and Wayne counties. You can see a full list of sites and zip codes on the slide. I do want to echo Dr. Box's remarks about the slower uptake among people in their 40s and 50s. Our data continue to show that people in their 40s are 3 times at greater risk of hospitalization and severe illness and 10 times at greater risk of death from COVID-19. So please, do not take this disease lightly. Get the vaccine so that you can protect yourself and the people that you love. Our plan is to open eligibility to Hoosiers who are age 40 very soon. Thank you for everything you are doing to help protect Hoosiers from COVID. We are all looking forward to the better days ahead. Thank you.
Dr. Weaver and Dr. Box, and we'll now move remotely to Terre Haute. Patrick, thank you for joining us remotely. You represent the hospitality industry at large in various ways, but both lodging and restaurants took a pretty powerful pandemic punch and seem to be kind of getting our footing underneath us right now and playing a little more offense as the days and months ahead are unfolding. Can you give us a status report?
Absolutely, Governor. Thank you very much for having us, and thank you for allowing me to join you from J. Ford's Black Angus in downtown Terre Haute, a family-owned business, a restaurant that you enjoy many of life's milestones, as well as woman Kelly Ford, no doubtly runs and manages and leads this great restaurant in Terre Haute, like many restaurants, a female-led restaurant in downtown Terre Haute. A year ago, the Indiana hospitality industry went from 60 miles per hour to 0, frankly, in overnight. However, over the last summer, Indiana restaurants were in the front of the pack nationally and the clear leader in the Midwest in terms of getting restaurant employees back and restaurant employment rising throughout the state of Indiana. Late this past fall and early this winter, like many restaurants throughout the entire country, we did suffer significant losses in those gains, as many did. In the last 30 days, however, Indiana restaurants specifically have turned a strong corner. While we are significantly off pre-pandemic revenue levels, we are significantly better than our national peers and far and away the number 1 seed, if you will, in the Midwest in terms of revenue and sales. While this is excellent news to many, we are far from healthy. Today, I am joining you from one of those restaurants that are the hardest hit in the restaurant industry. Restaurants in central business districts, downtowns throughout Indiana, the nation, and the world have been impacted harder than anyone in this hardest hit industry. The restaurants that you identify with, you identify as key leaders and milestones for your community, often Hoosier-owned, continue to experience significant challenges in those geographic areas, yet many continue to be resilient. Indiana hotels, on the other hand, lost just over 45% of their top-line revenue last year. Also, due to that top-line loss, many other Indiana businesses lost revenue due to the lack of visitor spending. Hoosiers, the nation, and the world know that Indiana is the best at hosting conventions, trade shows, and sporting events. Whether it's at the premier youth sports facility in the nation at Grand Park, the single largest one-day sports event at the Indianapolis Motor Speedway, or the numerous NCAA events with Evansville currently hosting, as well as Central Indiana and Indianapolis hosting March Madness. At the same time, our convention centers are finding creative uses of our space from Fort Wayne to Indianapolis to Evansville, that they've been able to find those creative and, most importantly, safe utilizations of not just those facilities, but also in attracting business at this time. In many Indiana communities, and particularly in downtown Indianapolis, group convention hotels have and continue to see significant losses. Yet, at the same time, while I say that, How do we compare to our peers in the hospitality industry nationally and throughout the Midwest? We're doing significantly better than the overwhelming majority at this time. Indianapolis, specifically, the core downtown hotels, where we have large group convention hotels, we're hiring. You cannot find another market in the country or the world with group convention hotels that need people, need employees at this time. We are far off from pre-pandemic employment levels, but we are definitely moving in the right direction. Hotels nationally, as well as in Indiana, do not expect to be back to pre-pandemic levels of revenue until 2024. Restaurants, on the other hand, may get there sooner, but really we don't see that for another full year to more. The back half of 2021, according to all economists from a restaurant perspective, does look very positive. Yet we have faced significantly better than the nation, and again, we are significantly better than our peers in the Midwest. The revenue and employment loss in hotels is the most challenging issue that Indiana's hospitality industry currently faces. This is an area of particular concern for us. However, why is Indiana's hospitality industry in the lead pack? Let's talk about some of those things. Consistent adherence to best practices, wearing masks, physical distancing, proper hygiene, not just by restaurants and hotels, but by our guests as well. Absolutely critical. State health officials, I cannot stress this enough. State health officials working in partnership, not as adversaries in the state of Indiana. The state of Indiana has never rolled backwards. That action alone in other states, New Jersey, Michigan, Illinois, California, the list goes on, have lost significant personal bankruptcies, and significant numbers of restaurants and hotels have completely been obliterated by indecisive and inconsistent leadership at the executive level, as well as state health departments. You have not seen that in the state of Indiana once. A successful vaccination program, the decision to have a centralized one-stop shop at rshot.in.gov, and by calling 211, where you actually receive customer service, real customer service, has actually been the key determinator. And Dr. Box said this earlier, cannot commend enough of the supply we get it in arms. Yesterday, I became eligible. Before noon, I had my first dose. Before noon. Frankly, I went to one of those high volume sites that now our website is being updated. Again, customer service for Hoosiers. Fantastic. That is not the case in other states. Mayors across the state have allowed expanded outdoor dining. The creative partnership that mayors have found for their downtowns and for other dining communities and areas, whether it's in Evansville, whether it's in Fort Wayne, South Bend, Terre Haute, mayors have been proactive in allowing those processes. Our Alcohol and Tobacco Commission, almost immediately, in clear, consistent, concise information, allowed many restaurants as well as hotels special privileges, which frankly allowed us to pay many bills during that very dark time, which was absolutely critical. Did not see that across the board in the nation. State and local health officials, again, state as well as local health officials working together overwhelmingly to find creative solutions in utilizing public gathering spaces, outdoor and indoor venues, and also best practices. We've seen that time and time again. People talk about it oftentimes on this press conference. However, I don't think people realize that this dysfunction that exists in other states, not present here. Numerous regulatory relief. The HoosierHospitalityPromise.com, go visit it. When people get off planes in Indianapolis, people get off planes in all of our airports throughout the state. Hotels, when they check in, they see that. They know what they are expected of our guests that we welcome into the state of Indiana, as well as what we provide and expect for our teammates as well. At the same time, a firm but steady hand from the governor's office, which we are more than thankful for. While we have a long road to full recovery, we are unique as we experience success challenges at this time. I've done countless interviews, even today, about a great problem. We're hiring. We are actually hiring and having a hard time finding people. That's great success problems. We would greatly encourage Hoosiers to continue to support Indiana restaurants in whatever manner they are most comfortable. Go support the restaurant you have enjoyed so many of your life's milestones, particularly those in the downtown areas where you live. Go enjoy a staycation or find a new favorite getaway at a hotel throughout Indiana. The Dunes in Northwest Indiana, fantastic family getaway and couples as well. I would greatly encourage you to enjoy that part of the state that many people in Indiana are not even aware of. Also, when you are eligible, get vaccinated. Get vaccinated. We thank all Hoosiers for their resiliency. The Hoosier hospitality that the world knows us for is building momentum. We're showing those resiliency from the darkest depths of any industry. We continue to commit to the Hoosier hospitality promise, and we ask Hoosiers to see it through the checkered flag. On a personal note, thank you for this opportunity, and also I wish everyone a happy St. Patrick's Day. Thank you, Governor.
Well, I'd kind of like to yield the balance of my time to the distinguished gentleman in Vigo County, but I do know, Patrick, I did like how you wedged in there Grand Park from your home county, Hamilton County. Nicely played. And Patrick will be staying. Patrick, you're going to stay with us, right, for the whole hour?
Absolutely.
Perfect, to answer questions. And we also have Chris Johnston, who is available to talk about CARES Act 1, 2, or 3 for that matter. Rachel?
Dan Klein with Wish TV.
Good afternoon, Dan.
Good afternoon, Governor. It would seem to me that the frequency of expanding age groups is a clear sign that younger groups are not getting the vaccine. Are you concerned about this? How can you better appeal your message to younger people? Some people have talked about maybe more weekend clinics and things like that, because obviously that's been very popular. And now we're getting into younger age groups that, you know, are working during the day and don't have some of that flexibility of some of the older population. Can you speak to those things?
I can. I mean, I don't want to dismiss 23% in 24 hours in the 45 to 49 age group category, but absolutely, Dan, we are and will continue to lean in with our stakeholder communication planning. And I'll say one quick thing, and that is we'll continue to do that type of outreach, but also word of mouth inside a community is pretty powerful. And you can have every politician or elected office holder preach all the reasons why to get vaccinated. Patrick just listed many of them to save lives and long lingering side effects if you do get it. Increasing consumer confidence so that when you look around a restaurant and 100% are vaccinated, that's a pretty darn good feeling and keeps the doors open, and hiring and slowing the spread at the most basic level. But having a peer of yours testify to the fact that they had 0 side effects, and this is just a bit of insurance, is very persuasive. And we've seen that, obviously, the 80-year-olds and up, they were shut in, but the younger folks were out running for the last year. And we'll continue to see that as we get down. So you're tapping on something that's very important to us, Dan, and we'll continue to do that outreach. But you might want to add a little more perspective to how we'll continue to run forward.
Absolutely. You know, I think the other important message here is, as the governor says, the younger age groups have been out and they've been managing this, right? Been wearing our masks, socially distancing, going to work, going to our kids' things. As the elderly people have, many of them stayed home and missed everything. But what we want to do is to protect everybody, even that person that we may not know may be at risk if they would get COVID-19 to have a severe consequence, because we do have 20-year-olds and children and other people that get severely affected with this. So the way that Indiana can look forward is to get everybody vaccinated. And I think as we message this, the important thing is that this makes us comfortable, as the governor says, to go to the movie, take off our mask and have popcorn and a Diet Coke, to be able to go to the restaurant together where everybody's celebrating. one of our comms people who's been such an incredible help to us shared with me that she was in a restaurant and she saw 4 elderly people come together. It was 2 couples, and they were celebrating basically Easter, Thanksgiving, Christmas, birthdays, every single holiday that they had missed celebrating together. And it really just brings tears to your eyes to know that people can go back now and do those things that you want to do, right? Be at your kids' ball games. So that's really the message that we need to get out, is that this is how we get to where we need to be in the future. And masks are important until we get more people vaccinated. But I do want Lindsay to take a minute to talk a little bit about vaccine sites and how we are working to make them more accessible around the state.
Thanks, Dr. Box. I would add, too, that this past weekend in Sellersburg, I got the opportunity to talk to a lot of people that drove from all across the state to get there, and they shared with me their reasons for getting vaccine, and a lot of them were in that younger age group, and they said things like, they're looking forward to going back to concerts, but the most heartwarming one is that they're looking forward to hugging their parents again with 100% confidence that their parents are fully vaccinated, and then they're going to be fully vaccinated as well. We are working very hard to increase access to vaccines, including our update to our map so that you can find locations that may have longer hours, weekends, but are those more high volume throughput that may have appointments sooner. So I do want to recommend people to go to that. Additionally, we're working with local health departments as well as some hospitals, and really looking forward to having an increase in our Johnson & Johnson. And that's really where we're going to focus, having those mass vaccination clinics, especially on the weekend. So I would be paying close attention. All of those things are going to be starting to roll out, and we'll be able to share more information with all of you soon. In addition to the mobile units that I talked about, where we're really targeting vulnerable populations, populations that are in maybe hard to reach places, or where there's lower amounts of vaccine there for whatever reason, there's been great uptake, or a smaller population. So again, more information very soon.
Thanks, Dan.
Jody with WRBI Radio.
Good afternoon, Jody.
Good afternoon, Governor. How are you today?
All things considered, really well. Thank you.
Excellent. Well, my question, Jay, is for yourself as well as the doctors, and that is, in the last week, the House of Representatives introduced House Concurrent Resolution 18, trying to terminate the public health emergency as well as take away the mask mandate. I was wondering your guys' opinion on that.
Well, I think it's unanimous. We don't support that. I think that should go unsaid. Look, we've got a lot of session left. We are in the third quarter. Discussions are ongoing. I think we all share the same goal, and that's to get through this as fast as safely possible. And therein lies the devil's in the details. And we agree on so much, and we've made so much progress. You can listen to Patrick Tam's report. You can look at our employment reports. You can look at so many different economic indicators, and we are moving in the right direction. And then when you look at those health indicators, that's what we can't sacrifice, or it will infect our livelihoods. And so a lot of time left to answer you, but we'll continue to keep our door wide open and encourage anyone that has a good idea on how to get through this even faster, so be it. But we got to do it safely.
Lindsay or Doty with the Indianapolis Business Journal.
Afternoon, Lindsay.
Spend the $3 billion that's coming to the state from the latest relief package, and how you feel about lawmakers directing how that money should be spent.
Lindsay, I didn't get the first part. I got spend $3 billion and lawmakers. And
how do you plan to spend the $3 billion that's coming to the state, and then how do you feel about lawmakers directing how it should be spent?
Wisely, in one word. Look, we've got, and I see Chris is making his way up, but we've, again, the CARES Act 3 and the $3 billion I think you're referencing for the state. There'll be another $3 billion that's devoted to locals. We'll work with our legislative partners who grapple and deal with Indiana's budget this year. And we look forward to that. We met today on just this topic. We have the ability to emerge and accelerate away from this pandemic because of the strong position we went in and this assistance that's coming our way. But it'll be a team effort. And like I said, we're just in the third quarter. We've got till the latest, the 29th of April. Chris, you want to chip in any in terms of, and what I think would be helpful is, not just for Lindsay, but for everyone, is most of this funding, $3 billion, is allocated into specific areas, directed into certain areas. And so the $440 million for rental and utility assistance, that's going to be going down, that's going to be sitting right there for Hoosiers that are in need of it, on top of the balance that's still there prior to CARES Act 3. So you might want to, Chris, just talk about kind of the pie chart of what's directed, allocated, and then what's not. And then we'll be working on the budget with our legislative partners for the balance of the remaining part of session.
Yes, thank you, Governor. As the governor mentioned, the funding that was enacted last week and signed by President Biden is really drops into two major categories, and that is the funding directly to state agencies that will be helping to address the pandemic and the negative economic impacts from the pandemic. The governor cited the emergency rental assistance and utility assistance that Jake Sipe from the Housing and Community Development Authority described last week. The other, there is, which is different than the other CARES Act funding earlier in 2020, is there is direct assistance to state and local governments. It's estimated that the state will receive approximately $3 billion. Contrary to the original funding, the 2.4, the Coronavirus Relief Fund that was received in 2020, that funding was directly for fighting the virus, covering public health expenses, other medical expenses, and economic recovery. There's still an element of that. One of the eligible uses is to still respond to the public health emergency, the negative economic impacts from that. There's also specific uses such as water, sewer, broadband assistance. But the new component that wasn't there before, and you may recall me saying that the states could not use the money for revenue replacement. There is an element of budget relief that is in eligible use with the most recent package, and that's where the governor was saying that this does add a new wrinkle and should bring in a broader perspectives for discussing how that should be used. We are in the middle of that budget session, and I'm sure that will be discussed over the coming weeks as we finalize and the General Assembly finalizes its budget. I would like to say that I think throughout this exercise, our goal has been to use the money as judiciously as possible to create the greatest impact, positive impact for Hoosiers, to also think about how can we use the money to make an enduring impact beyond the life or the use of this money, but also at the same time not create any sort of obligation that the state cannot live up to after the use of this money.
And Chris, it might be helpful if we still have how many questions before the Treasury on this most recent package pending?
I'm sure there are hundreds of questions. We've submitted our own list of questions. What may sound like a simple reading of the legislation really generates a lot of questions. And so the associations that are out there that represent state government, that represent state and local governments, budget officials, county government, they've been asked by the U.S. Treasury to compile their questions and send those in to the U.S. Treasury, of which I think the deadline is this Friday, and it'll take some time for them to sort through those questions and send out their feedback as well as their responses to those questions. the viewers may recall a theme that I often cited over the course of 2020 is that we received updated and periodic guidance from the U.S. Treasury, and I suspect we're going to be seeing the same sort of thing, is that there will be initial guidance, but then that will be revised over time as the programs are administered.
But Lindsay, that will factor in over the course of the next month for legislative leaders and members putting together the budget, and for our team. We don't want to allocate dollars for a program that's ineligible down the road.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. Happy to talk to you again for the second consecutive day. Two questions here. Dr. Box, you piqued my interest earlier. Could you recap those statistics about the number of vaccines that we're getting, and do we have an explanation as to why Indiana is receiving fewer than some less populous states? And then my other question is regarding uptake rates. We've seen uptake rates sitting at about 70% for older people. That hasn't moved a whole lot over the last couple months. It's been lower for younger populations, with estimates of herd immunity taking about 70% vaccination across the board. Is there some concern that we're not going to hit that level overall and get the communal effects of the vaccination on a wider scale?
So I think I can do both questions, and Lindsay may want to add to the second one on herd immunity. But Anna, she's shaking her head. She's so funny.
Yeah, she's brushing you off.
But herd immunity is important because that is how we can help protect individuals that can't get vaccinated, correct? And you know, that can be newborn children or people that have certain diseases or have allergies to the vaccine. And between the number of people infected, which we don't know how long that lasts, so you can't rest on that. You still need to get your immunization. And the number of people who get immunizations, we know that there will come a point in time when we have plenty of immunizations and vaccines. And what we're really looking to do is to encourage more people to get out and get their vaccine done. And I think a lot of that will come in as they talk to their primary care providers and other people as they return for appointments. Individuals will be able to have that discussion with their primary care physician, and we'll continue to work with those individuals in those populations or communities where we know there's particular vaccine hesitancy. And some of that may be not just our minority populations, it could be rural populations, it could be our younger population that really hasn't seen the severe consequences. When I was talking earlier about the different things, we said basically that Indiana administers more than 85% of the doses that we've received, which is above the national average. In fact, the 12.7% of Hoosiers that have been fully vaccinated is also above the national average. So we're efficient at using the vaccine that we get. But when we look, and the vaccine tracker on the CDC's website actually identifies the number of vaccines given per 100,000 population, Indiana it has several thousand doses less than many states. And in looking at that, that gap seems to be widening as we're seeing more and more of these larger FEMA sites pop up across the United States, which originally we kind of thought that vaccine was going to come out of the state's vaccine allocation, but that it appears to be a separate allocation to the states. So that is, I think, as where we're seeing the gap, and there are other states that have noticed a similar issue.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon, Governor. I was hoping not to belabor the point, but I was hoping to ask Dr. Box what can be done to get more vaccine to our state, especially states around us have long-term timelines. You know, in the next couple of weeks, they plan to go down to 16 and older. So what specifically is the state doing to say, hey, remember us over here next to Ohio?
So we've had lots of conversations, and we'll continue to have conversations with our federal partners who have been amazing partners to us throughout this entire process. So as we discuss with FEMA, as we discuss with, General Perna, we discuss with the CDC. I know the governor and his team are on with the White House many times, and just basically opening this discussion up, I think has made and will make differences. I think also the important thing to know is that the federal government has given us the indication that this hopefully is going to be a short-lived process in that we will all be receiving large amounts of vaccine by the last week of March and into April. So hopefully the vaccine is going to open up for everybody at that time. It's just particularly critical to us right now as we're working with some of the vaccine variants that we know the state of Indiana has.
Yeah, and I would say, Dr. Weaver, you want to chip in anything? You're brushing me off too?
So I agree. Dr. Box and I are on many phone calls. We are advocating for Indiana. And I just want to say I am profoundly proud of all of our partners across the state because we have been so efficient in getting vaccines in arms. And I don't know if that has anything to do with why maybe we're getting less, but we are really doing an incredible job. 85% of vaccines that we receive go in, and we have a goal, of course, every single week to do better. And we're prepared and we're ready when those vaccines come that we will continue to push it out as quickly as we receive it.
Yeah, and I would just add that, you mentioned the 17th, we rank 17th in terms of population in the country, and that's where we want to be. That's where we see true equity. And quite frankly, Sherry, I would like you to belabor the point. I belabor the point every conversation I have. We point it out. I'm not alone. Every state in the country looks at their population and makes the case that why aren't we getting more? But until we do, we will put good use to what we have, and we appreciate our partnership. In terms of, Sherry, you threw out a date with a neighboring state, I think. In terms of our plan going forward, I mentioned last week that I would give a statewide address, and I'll articulate exactly where we're going as well. That will occur. Rachel doesn't know this, but that's going to occur at 5:30 next Tuesday on the 23rd. That just so happens to be a year to date from a previous statewide address as we were sailing into this storm. And so we're all talking about when you drop down to 40 or when you drop down to 16, when you open it up, with the caveat of there's a direct correlation with the supply that we have. We have always been methodical and optimistically cautious, but cautious about over-promising. We want to be able to deliver wherever you go, and we're starting to see options, and we're looking at the uptick, the rates with each age group, but we're getting there as well, and I'll have many more details about just how optimistic I am come Tuesday at 5:30.
Rasmus with the Elkhart Truth.
Good afternoon. Thanks for joining us.
Good afternoon. I was hoping to get some more information on the mobile vaccination units, specifically how those 3 counties were chosen. How long will the units stay? Is there a goal for how many people you want to get vaccinations to? And specifically here in Elkhart County, is the Amish population the one that you're trying to reach?
Dr. Weaver, you want to take that one?
Yes, thank you. So we took many things into consideration. One of the things that we did is we looked at the social vulnerability index across the state and then vaccine uptake. So where did those two things overlap, where we saw that there's more of a vulnerable population and also where we see lower uptake in vaccine. And additionally, we looked to see how much vaccine is available in the surrounding area. And that's how those places were chosen. And there will be more every single week where we're going to, again, go out to 3 locations, 4 days, and then we will update the schedule, like I said, so it'll be out there here tonight or first thing tomorrow, available for appointments. I don't have that number right off the top of my head, but you'll be able to see when the schedule opens up.
Yeah, the more supply we have, the more convenient it can be. Mm-hmm. And so we're only restrained or constrained by the supply that we have.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hello. I wanted to follow up a little on the states that are opening it up down to 16 and things like that. Given the hesitancy we're seeing, some of the age groups, I guess, why not just open it up and let people who want to get it instead of, the people who aren't getting it? And then I have a follow-up.
Well, I think our track record speaks for itself, and I think we want to make sure, by the way, some of these states are saying we're going to open up on the 29th of this month, but they just announced it yesterday, or we're opening up on the 1st, or we're opening up on the 16th of April. They're projecting when supply will meet demand in terms of the uptake of who's eligible. And so, again, not trying to dodge, duck, or dip away from answering your question, but I will have more to say come Tuesday about our long-term planning going forward. So I understand where Ohio's coming from. I understand Wyoming, et cetera, who are talking about down the road. It's exactly what I'll do. But in between then and now, we're going to still be encouraging folks who are 45 to 49 to join the party. You had a second question, Nikki?
Yeah, I just wanted to find out, Dr. Box, you've mentioned some stats in recent weeks about, such and such group is 30 times more likely to have a bad reaction or severe illness. I'm just curious, where's those stats coming from, and 30 times more likely than who?
So most of those were 20 to 29-year-olds, but Dr. Weaver, do you want to address that? That was statistics you and your advisory committee looked at?
Yeah, and the one that jumps out at me, I think that we reported recently, was the 40-year-old with comorbidities is 10 times more likely. So you might want to source that, Lindsay, and then talk about the different cohorts.
So if you go to the CDC website, there's actually a nice table that shows you, based on age, decades, how more at risk you are the older you get. And that includes our 40 to 50-year-olds. So we actually looked at specific data here in Indiana and found, of the COVID cases, how many people were hospitalized in different age brackets, how many people died, and found that our 40 to 50-year-olds were 10 times at risk of death compared to the 20 to 30-year-olds. Now, and I think that's another important message that I really want our 40 to 50-year-olds to hear, that even though you may fancy yourself healthy and think that you would probably do fine, a lot of people in their 40s and 50s have underlying conditions they are not aware of yet, whether it be cardiovascular disease, whether it be, type 2 diabetes that hasn't yet to be diagnosed. So I think that is why, honestly, we see that higher death rate when these older populations, that it's the fact that there's more people with diagnosed comorbidities and there's also more people with undiagnosed comorbidities. As far as all of our other at-risk conditions, we looked at all the available data that there was out there, including from the CDC, other national reports, as I mentioned before, about what their elevated risk level was. And that's why they were specifically called out, so that we can get them in now and get them vaccinated as soon as possible.
Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon. I have two questions.
Okay.
One, if Indiana administers 85% of the vaccines received, what's happening to the rest? I understand we're above the national average, but why can't it be at 100% or higher than the 85?
Don't fight each other to answer this question.
Dr. Weaver's shaking her head yes, so I'm going to let her answer
Kayla.
it. Go ahead, Lindsay.
So that number is based on the total amount that we receive in 1 week. And so the vaccine rolls throughout the entire week. It's available for us to order on different days. It comes into the state on different days. So you can't just take a 1 week snapshot and say, why didn't you get all 100% in that week? Because we may have just received a huge shipment on, for example, Saturday. And if that's considered the last day of the week, then of course we're not going to get all those vaccines in. So it just rolls into the next week. But I still think it shows that we are very efficient, that as much as we are getting in, and the fact that it's a 1 week snapshot, that 85% is going into arms.
Awesome. Can you still hear me?
Yep.
Excellent. My second question, is Indiana offering money to locations hosting mass vaccination sites like the University of Notre Dame? If so, how much money?
No, I don't think we're giving. We do have funding through FEMA that we have used for our mass vac site at IMS, but honestly, pretty much everything, including lots of time from personnel, sites, assistance, consultation, has just been given out of the goodness of Hoosiers' hearts to support these.
And when you talk about Lindsay, you mentioned, or maybe Dr. Box last week, the 300 staff and volunteers out at the IMS, for example. But that came down to a lot of the goodness of people's hearts and their own wallets.
Rob Burgess of the Wabash Plain Dealer.
Rob, good afternoon.
Good afternoon. Two questions for the doctors. I know Moderna has begun vaccination trials in those under 18. What are you being told from the federal government in general about the possibility of vaccinating children at some point in the future? And then what are you hearing about the AstraZeneca vaccine, given some of the concerns that have been raised around the world about that vaccine?
So those are really good questions. You know, the AstraZeneca, there are several countries in Europe that have actually kind of paused the administration of the AstraZeneca because there was a concern raised that there were more blood clots in individuals that received the AstraZeneca vaccine. The UK has not really seen that. In fact, they felt like their incidence of blood clots was no higher than what they would normally expect in that population. And there was really a very small number of blood clots per like 1.5 million doses, I think, that had been administered. But it is still something that if countries feel concerned about it, it's not unwise to take a pause for a minute and look at your number of cases and complications, of which, you know, all countries have a reporting system for adverse effects or adverse events, just like our VAERS system here at the CDC, and to review that data, have your safety committee at the CDC or whatever that organization is in Europe and in other countries, and make sure that that they are not seeing an issue with it. Now, AstraZeneca, I think, is finishing up their phase 3 trials now, and the expectation is that they will probably apply for their EUA here in the United States at the end of April. We do know that several other companies are going forward and studying this in young adults, so that kind of age 12 to 16-year-olds. And we hope to have that information out this summer. I think that the other younger children and certainly the infants will be more in the fall time. So we will be working hopefully at the end of the year here to get 16 and above vaccinated before they leave school, to get all of those kids in college vaccinated before they head home, and then work over the summer potentially to get some of the adolescents vaccinated and still be working in the schools when we come back in the fall. Lindsay, do you want to add anything to that I might have missed?
You got it all correct. I agree.
Thanks.
Alan Carter, WTHR.
Alan, good afternoon.
Hello, how are you guys?
Very good, thank you.
I was wondering if anyone could provide insight about the case deaths and the hospitalizations that we are seeing now. Are we finding that it is more often people that are still of that same age group but have chosen not to get vaccinated or maybe didn't get vaccinated in time? And also, have you seen any hospitalizations or cases among people who have already been vaccinated, fully vaccinated?
Mm-hmm.
Yeah, we have seen a little over 100 cases of individuals who have been fully vaccinated. So they have to have been fully vaccinated for at least 14 days or more. And also those individuals, that positive test can't be within 45 days of their last positive test, because we do know some individuals continue to carry that virus and may show up positive on a test, and it may not be a reinfection, but just an ongoing current infection. So we do know that there will be some people that don't respond to this vaccine. And again, that's why herd immunity is so important. We do tend to see that more in our elderly population. There have been a small number of those breakthrough cases that have occurred in our long-term care facilities. But again, the good news is there are very, very small amounts. The hospitalization data is all good and down, so I haven't actually analyzed or have in the top of my mind what those ages were of those individuals, but I would assume, and I can look at that and send that information through Rachel after we're done here, would be in the older age groups again for the most part.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor. I have two questions, one for you and then one for the doctors. Specifically for you, Governor, I understand that a petition was sent to you from the Asian American and Pacific Islander Alliance regarding racism against that group on the one-year anniversary of the pandemic. Given what happened on this past week in Georgia, just wanted to get your reaction to that and against general sentiment and racism against that group.
Yeah, there's no place for it, not just in Indiana, but in the country. And fortunately, we have some legal recourse for those who have been wronged. And I'm glad that we have that in place. But again, this is not who we are. And it's up to each and every one of us to be a role model and to be able to with open arms say, welcome to Indiana, grow your family, grow your business, grow your lives here. We are a welcoming place. And so while I feel for any of those outliers or feel for those who have been wronged and those cases that are outside of our borders, I should say, our duty is to make sure that every Hoosier feels safe, has the opportunity to do so, and that there is recourse if they are wronged. And we have that in place.
Thank you.
We had a second question.
And then last question here for the doctor. Yeah, last question here for the doctors. We're hearing from a lot. I know, Dr. Box, you mentioned specifically that, about the long-term care facility changes and the changing guidance for visitation. If facilities aren't following that guidance, what recourse do families have, and should all facilities at this point be opening up visitation unless they have those specific stipulations of a high outbreak or high positivity rate, which I don't think is necessarily present in any county in the state right now?
Right, that's a great question. So we had come out with some preliminary changes in visitation at the State Department of Health level, and then CMS came out with their new guidelines, which I discussed today. So we, as we speak, are probably releasing even broader recommendations and actual direction for our long-term care facilities about opening up visitation, and feel really, really strongly about this. There are very few exceptions, as you say, greater than 10% positivity rate, a new outbreak of cases that started in the facility, not someone who works outside the facility, got their infection outside the facility. We do still have to quarantine individuals, even if they've been immunized, because they're living in congregate living. If they've been directly exposed, that close contact for, within 6 feet for longer than 15 minutes until they can be tested and be found to be negative and asymptomatic. But really, visitation inside should be open pretty much at all times. It shouldn't be just a half an hour visit anymore. And if you're having struggles with that, our website will have this information and how we've directed the long-term care facilities, but you can reach out to the Indiana Department of Health, our regulatory division. There are also ombudsmen that are engaged with our long-term care facilities or the long-term care associations, and we would be happy to look into those cases.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.